Steward healthcare hospitals are located all over Massachusetts, but now something is coming that will connect them in a unique way. It's called an eICU, a boon for doctors and nurses, and for patients, a lifesaver.
I need some help in here.
Patients in the intensive care unit at any hospital are the sickest and most vulnerable. They need constant, watchful care. But meanwhile, there is a serious shortage of critical care doctors and nurses.
I don't want it to get any higher. We don't want any CO2.
In December 2011, Steward Healthcare launched the first phase of its eICU program, a milestone in providing a new level of exceptional patient-focused care.
I'm very excited about this program. It's new and innovative, and it's the first of its kind in the Boston area.
Here at the remote center of the operation in Westwood, Massachusetts, physicians and nurses who specialize in critical care will partner with the bedside clinical staff, using remarkable real-time two-way communication.
Can you page the physician for me?
Sometimes that nurse needs some extra support, and the eICU can provide that extra support at the bedside.
Are you doing okay, gentle lady, here so far?
At the Westwood Center, highly trained staff has immediate access to patients' vital signs and medical records. They communicate with the bedside nurse using a high-powered camera, a speaker, and microphone.
You probably want to look at your chest tubes. I'm not sure it's fluctuating well.
These highly experienced nurses and intensivist physicians will add another pair of eyes and ears to the patient's care.
We can page physicians, we can look up lab values, we can look up medications. Any information that the nurse has at the bedside, we have that same information here.
The eICU program is a proven life-saving technology. Numerous medical journals report a 27% decline in ICU patient deaths, and patient time spent in the ICU drops by 17%. We're talking about a model that will actually save lives. Dr. Armin Ernst is the Chief of Pulmonary Medicine at Steward Healthcare and the lead on the eICU program.
This is truly one of the most exciting projects I've ever been involved in. The introduction of tele-ICU services into our network means that we can bring physician as well as nursing coverage 24 hours a day, 7 days a week to every bedside in every hospital in the Steward Health system.
It is an ambitious plan, which will be carried out in several stages, eventually adding eICU access to every hospital in the system.
I turned your oxygen up a little bit.
For staff who have been on the front lines of critical care for years, this is a welcome change and a huge step forward.
I think telemedicine is obviously going to be the wave of the future. I think it's opened up all across the country, and I think we're smart to jump on the bandwagon. I'm glad I work for Steward and that they've been innovative in this area. The bottom line is patients and good care and getting them home to the love of their families as quickly as possible.